August of 2008, I found out that I have pretty aggressive prostate cancer. And that took me as a real shock because I was just coming close to the 10-year mark of being clear on the previous cancers. And at the time, based on my numbers, surgery was considered the best option for me. So I had an open RP done also at the downtown St. Francis. Was in the hospital 4.5 days, and it was a good hospital experience. Very serious operation, very serious recovery. But I had a great surgeon, and the staff in the facilities, the nurses, everybody has always made all of my operations much more pleasant than one normally expects when they're in the hospital. First few months after my last major operation, I was at another rehab more local to where I live just because I had a hard time even driving around, but it was totally inadequate, both as an oncology patient and as a new ostomy person. They didn't seem to have a clue in either one of those areas. And as soon as I had the opportunity, I had my doctor refer me back to the St. Francis program, and I've been here several months now, and it's as good as I remember. Very satisfied with the level of care. Again, the one-on-one. They're very tuned into the needs of an oncology patient, which is different than a lot of other type of physical rehabs. Without the oncology rehab to go to, I don't feel that I would be getting remotely enough exercise and recovery and movement and strength and endurance and stuff. So it kind of gives me a built-in incentive. Like most people, if it was left up to me, I'd sit on the couch and watch TV and think about doing exercises. But in their program, it's again one-to-one. They know what I can and can't do on a given day, and everything's geared around that. So that's very important to me right now, because fighting what I've got to fight ahead even still, I need to be in as best shape as that I can possibly be. And this twice-a-week rehab's a very crucial part of that right now in my life. I am a Roman Catholic, and I like the historic background of St. Francis hospitals. I'm comfortable with that. I think before every operation I've ever had, I've had a chaplain come in for a prayer before being wheeled off to the OR. I belong to a very large online prostate cancer support group and have ever since my diagnosis. That helps a lot. I spend a lot of time there. And then I have good relationships with all my doctors, which I feel is very important in dealing with things like this. Then of course, my twice-a-week visits to the oncology rehab all kind of makes up the new life that I'm going through and adjusting to. And I look forward to it every week. Can't say I'm always physically eager to do it, but I know it's for my own good, so I keep coming back. So I feel I'm fortunate that I have a good support network. And again, having a wife that's a very experienced nurse helps me make medical decisions a little bit easier. A message of hope to anybody dealing with cancer, not just prostate cancer, is to never give up hope. There's always new treatments on the horizon, new medicines being developed. Cancer to me is a very one-to-one thing. My current medical team, I like their approach. We don't treat a number, we treat the patient. The worst problem with a newly diagnosed cancer patient in particular is always fear, especially if you're dealing with a cancer for the first time. But the best way to overcome fear in cancer is with education. The more you know about your situation, the more you know about your treatment possibilities, the more opinions you get, or second opinions either, the more educated you become on your situation, it will eradicate most of the fear. Not saying it'll take it all away, but it most definitely helps to be as educated as you can. And secondly, if you don't have a support network, start working on one right away as soon as you're diagnosed, whether it's with friends, family, church, whatever's important in your life. I find those that kind of hide their disease are ones that have the hardest time dealing with it. I'm more like an open book with mine. Anyone that'll listen, I'll tell my story. Well, for prostate cancer in general, 1 out of 6 men will be diagnosed and will have to deal with it in their lifetime in the United States. 28 to 30,000 people die every year of prostate cancer. The best first step is for all men to have regular PSA testing, at least by age 50 to get a baseline. If you're African American or if you have a family history of prostate cancer, it'd be better to move that up to age 35 or 40. Knowledge is power with cancer, and what you don't know can kill you.